Hello, friends. Welcome to the channel. My name is Joyle. Today, I'm going to talk about the urinary system. Anyway, don't forget to subscribe to the channel for new knowledge. The parts of this video is filtration, reabsorption and secretions, concentration and gradient, fluid balance, vasopressin, acute renal failure, chronic renal failure, UTI, kidney stone, kidney cysts, urinary incontinence, filtration, reabsorption, secretions. The body maintains water homeostasis remarkably well. The kidneys play a major role in regulating the fluid volume concentration by carrying out three processes. Urine formation begins with the first process, glomerular filtration. In the nephron, a specialized capillary bed, called a glomerulus, filters fluid waste and water out of the bloodstream into the renal tubule. During the second process, reabsorption, nutrients, including water and electrolytes, cross the wall of the renal tubule and are reabsorbed into the bloodstream. During secretion, the third process, when these three processes function properly together, urine is concentrated, an acid-base balance is maintained, and waste and water are either retained or removed. This is how the body maintains water homeostasis. Concentration and gradient. The first step in generating a concentrated medulla is to increase the concentration of tubular fluid in the permeable, thin, descending limb, which occurs as sodium ions seep in. As this fluid cycles back up to the highly impermeable, thick, ascending limb, sodium ions are actively pumped into the interstitium, some of which then cycle back to the descending limb, thereby multiplying the concentrating effect. Fluid balance. Water constitutes about 60% of the human body. While fluids are ingested and excreted at varying rates, the body has a remarkable ability to maintain homeostasis by regulating volume of fluid and its concentration of electrolytes. Inside the body, water moves freely across all membranes that separate the interstitium from the intracellular and intravascular spaces. However, electrolytes and other substances in the water cannot cross cell membranes. Substances like salt remain in the intravascular and interstitial spaces. The body maintains homeostasis by constantly regulating fluid exchange and ion concentration balance between these spaces. Focus on the water molecules and sodium ions. When excess water has been ingested, the body's concentration of water is higher than that of sodium. Water osmoses across membranes and into cells to achieve homeostasis. When there is too much water in the cells swell. This swelling makes us feel bloated. When less water is ingested, the concentration of sodium in the interstitium builds. Water travels across the concentration gradient out of the cells to achieve homeostasis. When too much water is needed in the interstitium from the cells shrink. This shrinkage makes us thirsty. Under stable conditions, even with varying volumes and concentrations of fluids, homeostasis is maintained by the permeability of cell membranes to water and their impermeability to sodium. Vasopressin. Vasopressin travels to the collecting duct, which is highly impermeable due to intercellular tight junctions and cholesterol-laden apical cell membranes. But when vasopressin docks to its receptor, stimulating the phosphorylation of aquaporin-containing vesicles and targeting them to the apical cell membrane, the collecting duct becomes water permeable. Acute renal failure. Acute renal failure is a sudden disruption of renal function. The common causes, categorized as pre-renal failure, Intrinsic renal failure and post-renal failure are grouped by the location of the disruption. In pre-renal failure, blood flow to the kidneys decreases. A drop in oxygenated blood supply to the kidney damages the tubules. The rate of glomerular filtration decreases and reabsorption of water and sodium increases. The resulting electrolyte imbalance can lead to metabolic acidosis. Pre-renal failure is caused by conditions that prevent adequate blood perfusion to the kidneys, such as hemorrhage, congestive heart failure, and dehydration. Intrinsic renal failure is when there is a breakdown in the nephron. Diseases of the tubules and collecting ducts disrupt normal reabsorption and secretion. Diseases of the glomeruli prevent the kidneys from properly filtering blood. Acute tubular necrosis is the most common example of intrinsic renal failure. Post-renal failure is caused by a breakdown of function in the ureters, bladder, or urethra. Renal stones and tumors are conditions that can block these ducts, leading to renal failure. Chronic renal failure. Chronic renal failure is the gradual breakdown of renal function. When the vessels leading to the kidney don't provide adequate blood supply, or the structures of the nephron are not functioning properly, the kidney's vital functions are compromised. As chronic kidney failure worsens, damaged glomeruli and tubules fail to properly excrete sodium and other ions. Urea and other waste and toxins build up in the blood. Vitamin D receptors in the kidney begin to fail, calcium absorption in the body decreases, and bone health erodes. The kidney's production of erythropoietin decreases, leading to a general decrease in red blood cell production. Chronic renal failure is caused by conditions such as hypertension that damage the kidney tissue, primary diseases of the kidney, and repeated cases of acute renal failure. Glomerular filtration rate indicates the severity of chronic renal failure and helps determine the course of treatment that can slow its effects. UTI. A urinary tract infection, commonly called a UTI, can cause inflammation anywhere along the genitourinary tract. Usually, the infection begins in the urethra and moves towards the bladder. This condition is called cystitis and occurs more commonly in women for two reasons. The shorter distance between the female urethral opening and the anus facilitates the spread of gastrointestinal bacteria to the genitourinary tract, and the female urethra is shorter than the male's, allowing infections to reach the bladder more quickly. Urinary tract infections can spread through the blood, and if there is reflux of urine back into the ureters, the infection can reach the kidneys, a condition called pyelonephritis. Predisposing factors that increase the risk of a UTI include congenital abnormality or blockage of the genitourinary tract, a suppressed immune system, catheterization, and menopause. Urinary incontinence. Urinary incontinence or WUL is the loss of bladder control. Most bladder control issues arise when sphincter muscles of the urethra are too weak or too active. People can leak urine when they cough or sneeze or have a sudden, strong urge to urinate. Kidney cysts. A cyst is a fluid-filled sac, and one or more can develop in the kidneys. There are two types of kidney cysts. A simple kidney cyst is a rounded pouch or a closed pocket that is usually filled with fluid. Polycystic kidney disease occurs when clusters of cysts form inside the kidneys and take the place of the normal tissue. The affected kidneys become enlarged and work poorly. This inherited condition often leads to kidney failure. Kidney stone. Kidneys create urine by filtering out waste dissolved in water from your blood. A kidney stone is a solid deposit that forms in the kidney from particles in the urine. It is made of mineral and acid salts, which crystallize and stick together. If the stone is small, it can pass easily out of the body and no medical treatment is needed. But sometimes a larger stone will get stuck in the urinary tract and it can block the flow of urine. This can cause a lot of pain.